Good morning and welcome to another session of iPros TV. Today's special guest is Andrea Cristal, West Regional Sales Director of Individual Exchange Sales for United Healthcare. We're really excited to hear about UHC's reentry into the ACA market. To my left from Team iPros, we have Gary Manchelenko. Good morning, Gary.
Good morning, Juan.
Welcome. Gary's responsible for our business development in the Colorado market. We're really excited about our partnership with Gary. He's homegrown, lives in outside of Denver, Colorado.
Yep.
I just flew in this morning. How was the flight?
The flight was good.
Awesome.
It was good. A little chilly in the morning, but coffee warms you up and gives you a little energy for today.
Awesome. Well, welcome to sunny Southern California. Don't want to take more time away from Andrea Cristal, so we're going to turn it over to Andrea so she can tell us more about this exciting entry back into the ACA market.
Thanks for having me, guys. Really appreciate the introduction. And I am coming to you from Denver, Colorado, where it is not sunny today. It is gray and overcast, which is a little bit rare for us. Just make sure you're seeing. Are you seeing my screen just yet?
Yes.
All right, so let's go a little bit into UHC. We're really excited to partner with iPros. I was very fortunate to be able to meet Juan and team a couple of months ago now, I guess it has been already, and was just delighted to see this business model. And I think from a cultural fit and from a community-based organization fit, iPros and UHC are just very tightly aligned. So we're really excited to see where this partnership takes us throughout the season. So let's go through a little bit of what's going on in our reentry into the market with individual and family plans. So today we'll go through a little bit just high-level overview, 50,000-foot view of what United Healthcare is doing in the individual and family plan market in 2022, what those plans look like, and then how we support our agents. So my name is Andrea Cristal. I am the West Regional Sales Director of United Health Group, and I lead the individual and family plan market. I've worked with agents for 15 years for United Healthcare now, so I've been in different parts of the organization and have found my home here in the IFP market, and I'm very excited to partner with you all this coming season. So let's look a little bit into 2022 and what we'll have coming for you. So our big focus this season is count on more for you, more for your consumer. We want to make sure that you are attached to partnerships that you can trust and that we can bring the value to your members moving forward to make sure that they have everything that they need and deserve in their health care. So let's watch a real short video just overviewing why United went into this space. And gentlemen, let me know if the audio on this does not want to play nicely.
We'll do, Andrea. We're not hearing any sound.
You're not hearing it? Okay. Apologies. We may have to skip the video. I am sorry. Sometimes with Zoom, it does not like to utilize the audio. So I will just walk through what the video says. I apologize for that.
No worries.
The audio does not always work there. So let's walk through why the opportunity, why now. So the Biden administration has put a lot of money into the Affordable Care Act this season with the American Rescue Plan and the American Families Plan. And with those bills going into law earlier this year, now 80% of beneficiaries can find a plan for under $10 a month after their premium tax credit. And this is coming from Centers for Medicare and Medicaid Services. Really, really important to us because oftentimes you'll hear in the community that these plans are unaffordable, and this was something that was very important to United Healthcare to make sure that we were able to care for members for the entire duration of their life, from cradle to grave. They're able to have United Healthcare as a plan option. And not being in the ACA market in the last several years has been a large hole in that strategy of us caring for members and helping them live their healthiest lives. So we're very excited that now we're able to offer plans at an affordable price for all members in the community. So more for customers. So what do these plans look like? What are we doing? So you'll see across the footprint, and we'll get into what that footprint looks like here in just a second. No cost doctor's visits, low cost prescription drugs, wellness on a budget. We have partnered with Peloton, which we're so very excited about this upcoming year, that our plans have Peloton baked in many of our markets. And in markets that we don't have Peloton, we have other gym memberships and health forward benefits available. $25 gift cards in many markets as well, just for visiting that primary care doctor. And then a number of different plan types, depending on what those members' needs are. Anything from Essential Plus to our Advantage Plus, which are very rich plans, to Virtual First options. So looking at the country and our footprint, we are expanding into a number of different states this year. So we've been in several states. We were non-commissionable in every state but Colorado. So coming to you from Colorado and talking about the Colorado market is very, very exciting. This was our first market. As we dipped our toes in the water in 2021, we've really been able to figure out the market with Colorado. This was the only market that we were paying commissions in. We own a company called Rocky Mountain Health Plans here in Colorado, and it is one of the lead plans in the market. In fact, we, at least the initial numbers, look as if we'll be the lead in almost every rating area in Colorado this upcoming season. So we're very, very excited to continue to bring that brand that's so well known to the Colorado market, again, to individuals here this year, as well as expand a little bit more in the market. So looking a little bit nationally, just as a general overview of UHC and seeing why we've expanded. So in 2021, we just had that basic value product in a bunch of different states nationally. We were really dipping our toe in the water to see if we could get that product, pricing, network, everything to work the way that we wanted it to make sure that this was where we could be for long term. We never want to enter a market that we can't be sustainable and have long-term options for members there. We don't want them to have to go through the obstacles of having to change their plan every single year because the company didn't do what we said we were going to do. So everything that we're doing is very, very intentional. We've expanded from 21 to 22 into 4 different product types: Essential Plus, Value Plus, Virtual First, and Advantage Plus. And we've added in a variety of different vendors nationally. So Walgreens obviously is a name that many people know, Peloton as well, United Healthcare Vision, Dental, OptumRx, amongst others, just to add that value to these plans and to our members moving forward. We're also continuing to invest in high value benefits and virtual care to drive agenda growth. And again, this is really across the country, all of the things that we're doing, many different pilots going on. There's a Virtual First primary care pilot in a number of states, not in the Western region just yet. Those will be coming later on, really focusing on virtual visits, on no cost urgent care, low cost prescription drugs, as well as others for our members. And here in the Colorado market, we're also launching HCA plans, which we're really, really excited about for this upcoming year, coming from so much noise from the field of really saying this is something that we need, this is a gap in the community, and listening to what our sales agents are asking for. So just looking at some of the Western states, we won't go into a whole lot of detail here. Arizona, Colorado, Washington are all in the West region for 2022. So starting off with Arizona, just starting off alphabetically, we have been in the Phoenix metropolitan area not paying commissions in 21. In 22, we will be paying commissions, expanding and continuing to invest in that market, as well as expanding into Pinal and Pima counties with the Banner network, as well as a number of other really important medical networks there. Excited to see what we're able to do in the Arizona market this year with some key partners that we have there. In the Colorado market, really excited. Colorado is my home state, near and dear to my heart. We have a phenomenal reputation here under the Rocky Mountain Health Plans brand. So United Healthcare purchased Rocky Mountain Health Plans a number of years ago. So this is a legacy market. This is a market that we never left. We've been in since ACA came into law originally, and have learned to really grow with this product and with this marketplace, and with the expansions to this marketplace over the last year. We're also able to expand into a number of different states, or a number of different counties within the state. Many of these are single payer markets. So these are markets that have really only had one option. The not much of a competitive landscape for the consumers that live there. So our expansion is something that we've done intentionally. We're working very closely with the healthcare systems. In fact, next week I will be in Glenwood Springs, Aspen, and Vail, meeting not only with our agents in those markets, but also with the hospitals and our plan CEOs to really pull the broker presence together with the medical networks and celebrate this expansion and the options for those communities. So a couple different rating areas across across the state of Colorado. Metro Denver is in one rating area. We partner with Centura with our Colorado Doctors Plan, and are also expanding into HCA land, which is really exciting. That's the Health One Medical Network, and this is something that is by popular demand from our agents, really listening to what those needs are. The Colorado Springs market, we do have that Centura Medical Network, and then Grand Junction is really a liberal title for this market because it's essentially everything other than the Metro Denver and Colorado Springs market is considered Grand Junction for this. We have a long-standing relationship on the western slope in Mesa County. That's where Rocky Mountain Health Plans is based. And we're also expanding into a number of different counties along I-70 corridor and some of the mountain towns in Grand Lake, Moffett, Rio Blanco route, and Summit counties. So really, really excited to continue on the success that we've seen in the state of Colorado, to pull in a couple more new partners and continue to build this out. So just very, very excited about the Colorado market. We do have a couple things with Colorado. This is a little bit different than some of the pieces earlier in the presentation where we were talking national presence. Because we're based under Rocky in Colorado, the branding is a little bit different. It's all under Rocky Mountain Health Plans, and the product archetypes look a little bit different as well. So really listening to those needs of individuals in those markets, adding in different benefits on the front range, and we have a number of different trainings that go into a lot of details there as far as medical network goes, product benefits, all of that. So let's talk a little bit about what it's like to be an agent with United Healthcare. Agent onboarding and support is something that's really, really important to us at UHC. For those of you that know us from other lines of business, you know that we take our partnerships very, very seriously. We partner with a small number of FMOs on this product line, very, very few nationally. And we do that intentionally because we want to work closely with our partners, we want to trust our partners, and we want to grow with our partners. But in order for that to be successful, there's a lot that we need to do to support our agents and our teams in the community. So more for agents, a couple of different things. The first one is onboarding. So our onboarding support system is very turnkey. We're able to borrow tools and resources as we launch this product line from our Medicare line of business, which I've been with for 15 years before coming over here. Phenomenal team of individuals that lead best-in-class onboarding solutions nationally. So they've been able to onboard thousands of agents in the last several weeks alone. For selling, if you know us on the Medicare side of the business, you're also very familiar with Jarvis. If you're not, you will get to know Jarvis very soon. Jarvis is 24/7 access to book of business, training materials, and any business and marketing tools. You can also see commission statements and everything else there. We've also partnered with Health Sherpa for the industry-leading EDE platform, Enhanced Direct Enrollment, to really make a seamless process for enrolling all of your members. And then finally, support. My team is in place all the time to support you. Every day we have a team that's in front of their computers and on the phones, ready to support agents in the community, making sure that your success is our success. National and local marketing is set up to drive awareness and drive leads to the field. There's also an entire agent toolkit that's available to help you at any time, as well as our on-demand help desk and our marketing leaders. For onboarding, the TBD here is based on you onboarding with iPros. So you will receive an invitation from iPros at the time that you are contracting with them. Your agent information will be added to the system. You then go through a quick background check. You receive a welcome letter, and then your appointments are verified in Jarvis. And again, we're leveraging this system, really state-of-the-art system from our Medicare and retirement side of the business. So you may already be familiar with that agent lifecycle management team and what that looks like. Okay. Certifications. Certifications are done, they're step-by-step on the state and federal level. So depending on if you are onboarding in the state of Colorado, that's going to go through Connect for Health Colorado. If you're onboarding for any of the federally based exchanges, the FFM markets, then you'll go through cms.gov or healthcare.gov to take your certifications. We do require that our agents are certified to sell our plans. So whether you're in Connect for Health Colorado or you're in cms.gov. Also, if you're in Maryland or in Washington, which is not listed here, those are also state-based exchanges that we have within our selling footprint that you would need to be certified for. Within Jarvis, lots of selling and support material here. So within that agent portal, we've developed an agent toolkit that provides everything you need to be successful. In that, you're going to find market-specific sell sheets, direct-to-consumer marketing pieces, and education and training materials, all designed to help you easily communicate our offerings and what differentiates us in the market. You'll have full access 24/7 to these marketing materials, as well as to your book of business and commissions within Jarvis, making it simple and easy to manage everything in one convenient place. Added bonus for those of you that are in the state of Colorado, you have an additional support system within Rocky Mountain Health Plans, as well as marketing specific for Rocky Mountain Health Plans available. Our EDE platform, Enhanced Direct Enrollment, we've partnered again with that industry-leading vendor to make enrollment easy, reliable, and simple. Through our agent portal, you'll be able to leverage industry-leading Enhanced Direct Enrollment functionality. This technology will allow you to complete applications with speed and accuracy, improve client effectuation rates, simplify lead management with client search capabilities, leverage digital marketing tools, and view important documents and action items for you. And this is just a couple of screenshots of what that looks like. Very, very user-friendly tool, allows you to focus on what really matters and cut that enrollment time in half. In fact, most enrollments take less than 7 minutes in this tool. For selling and support, our marketing team is really second to none. We're so fortunate to be supported by an amazing marketing team. And some of those team members have really been with me since we started this project. They're so absolutely phenomenal. I can't say enough about our marketing teams. They're such a critical partner to all of us in sales by helping to articulate our value, our story, and what differentiates us from the competition. I appreciate everything that they do for us. They're so innovative, and you have access to this, Fortune 500 company and all of our marketing tools and resources at your fingertips. We're currently investing a lot of resources in our communities to promote education and awareness of United Healthcare's new individual and family plan options. You and your customers will see our marketing efforts online, digital, in print and billboards in the neighborhoods across the country. Our marketing team also creates a number of agent-specific marketing and direct-to-consumer tools to help you communicate what your consumers, what United Healthcare can offer your consumers. We're here to support your success, so we'd love to speak with you about marketing opportunities to help grow your book of business with United moving forward. And then support. Support is so important for agents. To be able to be successful, you need to be able to talk to people that understand the industry. We know that there's going to be a lot of questions as they arise, and we want to be there when you need us. So, and connect with us in the manner that suits you best. So if you need to answer a question of a client, you always have us available through email, through Jarvis chat, through a phone call directly to our team, and have expert support. Additionally, in addition to our call center and our producer help desk, and all the support that you have here, you have two dedicated support contacts, Mauricio DeCarmo and Tim Patterson, who support the West region. They support the state of Colorado, and they're here to work with our agents every single day. That's about what I had planned, gentlemen. What questions do you have for me?
Well, thank you, Andrea, for such an informative presentation. We do have a few questions for you. I'd like to start off in regards to the enrollment platforms. We know that currently, or before United Healthcare entering the ACA market in Colorado, you had the direct enrollment through Connect for Health. Now you present it on your platform available through Health Sherpa. Are there two pathways for enrollment?
There are.
Okay. Can you
Yeah,
elaborate
that's
a
an
bit on
excellent
that?
question. Yep. So for Colorado, agents can absolutely continue to use Connect for Health Colorado. We do encourage that certification for every single agent that's selling these plans. So they can continue to enroll the way that they always have through C4. Many agents prefer to use C4 so that they can manage their book of business in one place. They also have the option going directly through Rocky Mountain Health Plans and using the ED software there.
Thank you so much for addressing that question. Gary?
First, Andrea, thanks for coming back. I know myself and a number of brokers I speak to, we're really excited to be working with you guys. And but to help us out, which network partners would be the marquee group for us to look at, or for United in Colorado, and specifically, what's the hospital side going to look like for us?
Really great question. So it is largely determined by the market that you're serving. So Front Range, that's going to be the Centura Medical Network, will be the primary medical network, and we're adding in Health One currently. So we'll be adding in the Health One doctors throughout the season, throughout the year. We heard loud and clear that doctor's plan, we're very intentional in our product design and in our medical networks to have a curated medical network. So we don't want to have those huge commercial networks because we want to make sure we can keep costs low and appropriate so that our members can continue to save. In order to do that, we do need to have a smaller medical network. So we have Centura and then Health One in the Front Range. Centura in Colorado Springs. Health One is not yet added in Colorado Springs. For the rest of the state, everything west of the city, it's a much larger network. So you have SLC Health, University of Colorado, Centura, Vail Valley Medical Center, Valley Health, Alliance. I'll be working with all of those hospital systems in the mountain towns this upcoming week there, and anyone who would like to attend, feel free to reach out to me for an invite if you'd like to come to any of those events next week. But we have a really solid medical network across the state of Colorado.
Thank you, Andrea. Talking a little bit about marketing, there's always marketing questions, right? As agents,
Yep.
we're always looking for new ideas on how to grow our book of business. So we do plan to have a follow-up session that's specific to marketing. We know, or Andrea just presented some of the things that their marketing department is working on that directly impact agents. I know Andrea and I have discussed some co-op opportunities in all markets, Colorado included. And there's some grassroots outreach that we're conducting through our Colorado team. Gary Manchelenko has been in the market for many, many years, so he's going to bring a tremendous amount of experience about the local market. I'll turn it back over to Gary. I think you had some questions in regards to the binder payments.
Yeah, I was just wondering, I know last year when Rocky came into the market, and for us to facilitate making that initial effectuation payment for the client, it didn't seem like we were able to really help them out by doing that via the website. Do you know if we're going to be able to help our clients be a little more hands-on with making sure that we do get that policy effectuated so we can keep them on the books longer?
Absolutely. I mean, your goal is our goal. We want to make sure that we're getting that binder payment paid as quickly as possible. So there have, so I guess two answers to that question. There's two different things that are going on. So one, Rocky has made a number of enhancements to their system that you're used to that will be launched this year that will also assist with binder payments and being able to allow agents to support that. Additionally, we have stayed on Rocky's system for this year, but the goal is to move over to the UHC systems within the next several months. So there's much more access once the systems are changed from Rocky over to the UHC systems in the coming months of supporting that binder payment.
That sounds like more integration.
Yes, absolutely. Just the timing wasn't exactly right for getting it before open enrollment, so we didn't want to fix something that wasn't broken going into a sales season.
And I know we appreciate that.
Yes.
Gary, you and I have had some conversations when we first met each other, and we're looking into expanding in the Colorado market, and we touched on specifically United Healthcare entering the market, and then just making that decision to get out of the market. You want to talk about a little bit about that?
Yeah. Thanks, Juan. Andrew, I know, when I talk to colleagues, none of us are excited because also you're going into some counties that really only had one carrier. So
Yep.
that's really exciting for us to see that. But there's also some agents that are a little apprehensive because of the way that United kind of
Stood him up at the ball.
and backed off. And so naturally there's going to be a little apprehension. So how can we put agents at ease?
Yes, I absolutely understand and appreciate that apprehension. When we made the choice to exit in 2015, it was obviously not a popular choice, and one that many of our colleagues across the industry were really forced to make the year after. We made a lot of mistakes going in 2014. One of the biggest ones that we made was that huge commercial network that didn't support keeping the costs appropriate. There's really margins in this side of the industry that are paper thin. So we have to be very, very cost conscious in order to take care of that member at the end of the day. So 2021 really was us moving back into the community and dipping our toe in the water to make sure we were right on that. In fact, across the country, Colorado was the only market that we chose to pay commissions in because we wanted to be positive that we were right on the network, that we were right on the product and the pricing before we started to pull in a broker distribution channel. 2021 went phenomenally well for us in Colorado and in markets that we didn't have sales goals set in and that we weren't paying commissions in. We came in extremely strong in those markets because the consumers did want United Healthcare to come back to the market. So we're very excited to be here now, and we're committed to a long-term relationship in this space. So we're not moving into any markets that we can't do it sustainably. That's why we haven't gone to every single state and every county across the country. We want to make sure that we can grow that profitable network, that we have the right partners on the medical side and that we have the right partners on the distribution and agent side to grow with. So slow and steady wins the race, but we want to make sure that we have the right product and pricing in place before we move forward. So we're not leaving again, and I know that is something that we're going to have to prove to the market over the coming years.
Well, thank you, Andrea, for addressing that question, and thank you, Gary, for bringing that up. That's definitely an important question that we need to address. We know that United Healthcare is a respected organization nationally, so iPros as an organization feel very confident about our partnership with United Healthcare, and we're really excited about building, helping you build your membership in all of your markets, and Colorado being such an important market for us as well. We're excited to work with Gary and our team in Colorado to make that happen. We don't have any further questions at this time, Andrea. We really appreciate you taking the time out of your busy schedule to join us for this episode of iPros TV. I'd love to invite you back. I'm thinking maybe somewhere around the middle of the open enrollment. I'm sure there's going to be a lot of lessons learned, Gary, a lot of questions.
Yeah, absolutely. Hopefully we get lots of chance to test everything out and tell you how many enrollments we got.
I can't wait. It's going to be a lot of fun, and maybe we can connect on the Denver side when we're both in this state, which doesn't sound like it's very often.
Well, I may have to take a drive up to the mountains next week.
Hey, come on up. I will be there.
All right, well, stay tuned, everybody, for a follow-up session with United Healthcare, specifically around the lessons learned around the Colorado market. And once again, Andrea, I can't thank you enough for your support of iPros and all of our agent professionals out there in the market making it happen. So thank you, everyone, for joining us for this very informative session of iPros TV, and look forward to our next session.
Appreciate you guys.